Well, the whole background of why we decided to call it Dr. Pete's Big Event was because on other campuses, university campuses, they have a community service program called Big Event. And so most of our students are very familiar with the concept of what Big Event means. So we titled it Dr. Pete's Big Event. In each case, a student is the driving force behind it. They had group leaders, and those group leaders decided what community service the students would be doing, whether they would be mowing a lawn for senior services in West Tulsa. A group of them got out in the heat and they mowed a lawn that was pretty rough terrain, and did the weed eating, and the elderly woman was just very grateful. Then you had a group at the Day Center for the Homeless, and because of the heat, their numbers are just overwhelming, and our students got to see something that they've never seen before, and that is a mixture of what consists of a homeless population or a marginal homeless population in terms of people seeking out food and shelter when maybe they wouldn't normally be in that situation. So our students cleaned up the clinic, they mopped floors, they toured the facility, and really got to see what it takes to take care of the indigent group of homeless people in Oklahoma. And then there was a group of the Salvation Army, and they were painting and doing essentially, seeing the same thing, families. The Salvation Army caters more to families, and so they saw families who are homeless. Then we had a group that was at a equestrian therapy center, and they cleaned out stalls, and they got to see a different type of clinical, more physical therapy in ways of where children who are autistic, children who are severely disabled can go, and there's this magic that happens between the child and the horse. There's a healing that happens, and so our students got to participate in that. Some went to the SPCA, some went to the Humane Society. Healing takes place in so many different ways, and our students got to see that and experience, whether it was painting a wall or it was sorting clothes for DVIS, for domestic violence intervention services. They just became a part of the community, which is so important because they're going to become physicians. And part of that is becoming a leader in the community and understanding what it takes to be a leader, and what's your community going to look like, because the world is truly their patient and they have to have an understanding. So that was the whole premise of creating the Dr. Pete Big Event, was getting them started on this road that the world is their patient and they're going to have to be a part of it.